MND, also known as amyotrophic lateral sclerosis (ALS) or Lou Gehrig's disease, is a neurodegenerative disorder that affects motor neurons, the nerve cells responsible for controlling voluntary muscles. In Australia, MND is a significant health concern. Prevalence and incidence: MND affects around 2,100 people in Australia at any time, with about 800 new diagnoses annually. The disease typically occurs between the ages of 50 and 70. Types of MND encompasses several types, with ALS being the most common. Other forms include progressive bulbar palsy (PBP), progressive muscular atrophy (PMA), and primary lateral sclerosis (PLS). Symptoms and progression: early symptoms: muscle weakness, cramps, twitching, difficulty speaking or swallowing. Progression: symptoms worsen over time, leading to significant disability. Most patients lose ability to walk, talk, eat, and breathe without assistance. Causes and risk factors: genetic factors. Approximately 10% of cases are familial, linked to inherited genetic mutations. Environmental factors. Potential risk factors include exposure to toxins, heavy metals, and viral infections, though these links are not well understood. Diagnosis is primarily clinical, based on symptoms and neurological examination, often supplemented by electromyography (EMG) and nerve conduction studies to assess muscle and nerve function. Treatment and management. Currently, there is no cure for MND, and treatment focuses on symptom management and improving quality of life. Riluzole is the only drug approved for slowing the progression of MND in Australia. Supportive care. Multidisciplinary care teams including neurologists, physiotherapists, occupational therapists, and speech pathologists are crucial for managing symptoms. Research and advances. Genetic research. Advances in understanding the genetic basis of MND are ongoing, with efforts to develop gene therapies. Investigations into stem cell therapies hold promise for future treatment options. Australia participates in international clinical trials aimed at finding new treatments and improving patient outcomes. The impact of MND includes significant emotional and physical burden on families and caregivers, as well as economic costs related to medical expenses and loss of productivity. Support and advocacy. MND Australia, the national organization providing support, advocacy, and information for people affected by MND. Awareness campaigns. Initiatives such as the Ice Bucket Challenge have raised significant awareness and funds for MND research and support. Government and policy. The National Disability Insurance Scheme and DIS provides funding and support for people with disabilities, including those with MND. Policy efforts include advocacy for better support and services, increased funding for research, and improved healthcare policies. Conclusion: motor neuron disease is a complex condition with profound implications. Research, support, and public awareness are essential for improving outcomes and quality of life.